let's say that someone recognizes that they are anxious to a point where it's affecting their daily life. Is it possible for a person to get out of that? And what kinds of things do you use to help them, see past it, grow past it, however you want to say?
Yes, I am. That's one of the reasons why I went into psychiatry as opposed to
Mm,
neurology, because we see benefits of persons getting better, the benefit of the person getting better. In neurology, people do get better. Unfortunately, in neurology, you tend to see persons who have a stroke or some other neurological disease, and you're kind of doing maintenance. In
mhm.
psychiatry, you actually see people being cured, being able
Yeah.
to get better. So with anxiety, it's a two-pronged approach. Psychotherapy, which
Mhm.
really means talk therapy and the different modalities of that, ways to be able to help the person to calm down so that they're able to do whatever function that they're being asked to do or complete a task that they're able to do. And then
Mhm.
the other approach is with medication. And we don't approach both of those modalities the same way. Medication is approached when the person is no longer able to function at a level that he or she should be able to, and it's
Mhm.
impacting them so much that it is now really hurting them and affecting them negatively. And
Mhm.
so that's when we need to have a conversation about medication. Why is that important, Mr. Possibility? Because
Mhm.
anxiety is real and it is normal. I want to say that again. Anxiety is real and anxiety is normal. Everybody has it. Anybody who says they don't have anxiety is lying to you. All right. They're
Okay.
lying to you. And I say it right here and I say it again. Everybody has anxiety because it's part of who we are as a human being. But everybody's anxiety doesn't take them to the place where they can't function and they're paralyzed. And so that's when a disorder comes into place. And that's when we know that medication needs to be considered. So all of us could benefit from therapy and how to be able to manage our anxieties. Even as I prepare for this show, even as you're listening to me, I might look confident, but there may be
Mhm.
some butterflies inside of me being
Mhm.
anxious. And that's just normal. But it allows for me, I don't allow those butterflies, I don't allow that anxiety to take me out to where I pass out while I'm doing this show. I allow it to be
Right.
able to help drive me and drive that point home so that I come across looking like, man, he knows what he's talking about. But okay, that's wonderful. But I stay
Right.
humble because I know inside it don't always feel that way.
Well, I'll tell you what I want to say here now, because I've read enough to know that any professional like yourself who is transparent enough to say what you've just said is an amazing. I mean, my confidence in you just went sky high because you're able to say that. But what kinds of things that should parents look for? People who, you're raising kids, you got to be aware of what's going on. What kinds of things should they look for to try to make sure that they raise healthy children? And I want to focus just on anxiety now.
Yeah. So you look for any change of behavior for the children. You look to see are they eating correctly or appropriately. There may be a change in their sleep pattern. They may not want to sleep as long, or they sleep too long. They might be
Mhm.
scared to sleep in their own bed. I've even seen where adolescents they revert back to the childhood years because they're
Mhm.
fearful of something that may have happened. They complain of nightmares. They complain about various other things that literally did not used to scare them before.
Mhm.
I've seen where children have been traumatized and are anxious to be around certain people. Social anxiety is real. And so, not wanting to go outside to interact with other people, not want to interact with
Mhm.
family members. Um, and even with anxiety, you'll see a heightened sense or a sensation, if you would, of
Mhm.
sounds. They may hear a certain sound or even a smell, and it takes them and literally cause them to spaz out, to literally have an increased
Right.
fear
Mhm.
response. So those are some of the things that you would look for
Mhm.
children who are anxious. Um, yeah, and many times they'll tell you if you
Mhm.
listen to the child, they'll tell you what's going on.
Yeah. So what about this approach of a parents to a child or even adult to another adult? Snap out of it. Good advice, doc, or bad advice?
I would never tell somebody just to snap out of it. I would ask it a different way. I would say, what's going on? How are
Mhm,
you feeling? Um, what's making you feel like this right now?
mhm.
So ask some questions like that as opposed to giving a directive a snap out of it.
Right.
Because I don't know what the it is.
Yeah, yeah, I got you. And and I'm thinking about children and growing up, a kid growing up and afraid of the dark. And back in the day, Doc, what they would say to us is, "Be a man." What do you think about that advice? It's a kid is afraid of the dark.
Yeah, and I understand that. And we have to think about people's homes.
Mhm,
And so many of us have grown up in different environments now.
mhm,
So I understand that. We have to be careful of how we label people as being less than.
mhm.
What do I mean by that? So you're talking to a 12-year-old boy. Well, man up.
Yeah.
You shouldn't let that scare you. Well, we don't know what happened to his story, as I talked about, embracing the story. We don't
Mhm,
know that someone was sneaking into his room when he was 5 and 6 years old in the middle of the night, trying to touch him or trying to do something to
mhm,
him. We don't know. It might be in the middle of the night where his family had to escape a fire. We may not
mhm,
know what happened in the middle of the night when they did not have a place to sleep and they got kicked out of their apartment or home. We just don't know why.
yeah.
Uh, and let me tell you, and again, I know that's kind of extreme.
Mhm,
You might be watching a scary movie.
yeah.
Let's keep it
Yeah.
real. You might be watching some movie he probably should not have been watching. And
Right.
now they are, so scared and they hear a little sound and they think that this movie, because movies seem so real now,
Mhm.
it literally freaks them out.
Right. One more thing about anxiety, Dr. Shepard. I'm assuming, and that's why you're the specialist here. If a person catches it early, is the prognosis for resolving it better, or than if they let it, continue to grow until it's like a bucket of water that's spilling over?
Yeah. So when we talk about prognosis and mental health,
Mm,
overall, when you're dealing with anxiety and mood disorders, if the
mm,
person's consistent in treatment, prognosis tends to be good.
mm,
There are some of the mental health disorders where prognosis tend to be less, and that tends to happen with how long a person has dealt with the mental illness or mental disease, because it
mm,
is a disease. Um, but yes, the earlier that a person gets into treatment, we tend to have better outcomes. It's not a guarantee, but we
mm,
tend to have better outcomes. One of the major things that happens with or associated with better outcomes is
mm,
consistency.
mhm,
What do I mean by that? That means that parents, the children, adolescents, or whoever the patient is, must be consistent with the treatment process, and so that really is the determining factor.
right. I want to, and I know these things all run together, but I want to make sure that we talk about depression, by itself for just a moment. So, what is this thing called depression? I mean, what is depression? What does that mean?
Mhm. Depression is a mood disorder,
Mm,
and depression is a real illness. People use the word depressed loosely, and I
mm,
really believe if they really knew what depression was or the disease is, they would not use that word depressed.
mm,
It can be it's a constellation of events or symptoms. And I use the word events because the symptoms occur within events, if you
mm,
would. SIGECAPS, it is an acronym, SIGECAPS, 8 symptoms that we can experience or a person can experience for 2 straight weeks. So it's interesting that people will say they're depressed, but then when you look at the time frame, like, wait a minute, you have you've only been feeling like this for 2 hours, as
yeah.
opposed to 2 consecutive weeks. And so, what are those symptoms? I'll go through them very quickly. There's a change in your sleep pattern, change your level of interest in doing things. There is guilt, excessive guilt, change in your level of energy, change in level of concentration, appetite. The P is a big word, psychomotor retardation or agitation, basically meaning that there's an increase in your ability to, a decrease in your ability to self-regulate. That's really the major thing there. What does that mean, Dr. Shepard? That means that if someone comes and taps you on the shoulder and say hello, you blow up. That's what that is, you know.
Yeah, yeah.
All do is just say hello and wow. And the last letter S is suicidality. Anytime that a person is considering taking their own life or taking someone else's own life, depression needs to be in that differential diagnosis. So depression is a real illness. It is the number one illness in the world that causes the most debilitating factors. Be aware of that. It may not be the number one disorder. At one point it was. I'm not sure if it still is, but it definitely is the number one disorder in the world that causes the most debilitating factors to go along with it.